Hello everyone. My name is Karen Wing. As you know that we nurses will be soon to administer COVID-19 vaccine to our patients. So today I take this chance to provide the COVID-19 vaccine training, and the vaccine I will address here is Pfizer vaccine. The three objectives that I want to focus on this training including what need to know about safe storage and handling of the Pfizer vaccine in order to maintain its integrity, gaining knowledge on Pfizer immunization and its requirements, and lastly, to fully aware of side effects of Pfizer and who, what, when to report adverse events. As everyone knows that COVID-19 cases tremendously increased in the US, just want to look at the recently report from the CDC in January 30th, 2021. In last 7 days, there were total 25,780,144 cases, with total deaths was 435,151. The Pfizer vaccine, along with several others now in production, as our main way out of the coronavirus pandemic. The brand name of it is called Comirnaty. Biotech is the initial developer of the vaccine and partner with Pfizer for development, clinical research, overseeing the clinical trials, logistics, finances, and for world manufacturing. The trials of this vaccine started in April 2020, including three phases with total testing on 43,538 people from 6 different countries. After three phases completed, it reported that the vaccine had 95% effective on a dose and over 94% effectiveness on a dose over 65 years old. With this positive result, the United Kingdom government approved and allowed this vaccine to be used. And other countries give the Pfizer vaccine to all their people within a week after the UK government. It was reported that by December, over 500,000 people in Britain had received the vaccine as part of its national vaccination program. Pfizer company stated in November 2020 that estimated the 50 million doses globally available by the end of 2020 and 1.3 billion doses in 2021. Although the effectiveness of the vaccine is very high, but the challenges of it is how to maintain its integrity at all times. So knowing how to save storage and handling is the critical key to maximize its effectiveness. On the cold chain flow chart, it shows who is responsible on each chain. Pfizer vaccine relies on the cold chain to keep the shots colder than a freezer. It is a must on its journey from the production line to the patient's arm. The temperature has to be between negative 80 degrees Celsius and negative 60 degrees Celsius. And if it is maintained the vaccine in this temperature at all time, then they will be good to 6 months. Before mixing, the vaccine may be stored in the refrigerator between 2 degrees Celsius and 8 degrees Celsius for up to 5 days and need to be administered within that time frame. Otherwise, they have to be discarded after 5 days in the refrigerator. When the vaccine delivered to the healthcare facility, pharmacy needs to have the list of patients who will receive the vaccine. Then they will start the process of the preparation such as diluting, mist, and deliver to vaccinators who need to administer the vaccine within 6 hours. Those missed vaccines remain after 6 hours will be wasted and should not return to freezer storage. Vaccinators are responsible to report wastage of doses to pharmacy. As other vaccinations, it is critical to screen patients before giving the Pfizer vaccine. According to the Food and Drug Administration, we need to ask patients about any symptoms or medical conditions that can contradict to Pfizer vaccine, such as fever, bleeding disorder, on a blood thinner, immunocompromised, or on a medicine that affects immune system, pregnant or plan to become pregnant, breastfeeding, have received another COVID-19 vaccine, or any allergies. Any these conditions present, we need to seek for advice from the physicians before giving the vaccine. Besides that, we need to keep this in mind that currently that Pfizer vaccination only give to individuals 16 years of age and older, with patients who have had a severe allergic reaction after a previous dose and severe allergic reaction to any ingredient of the vaccine, then will not receive the vaccine, and nurses need to notify physician for updated allergy list. Per U.S. Department of Veteran Affairs, Pfizer vaccine is not contain live virus. It is designed for single dose zero point 0.3 ml. It recommended to give IM using 22 to 25 gauge needle, the set of two doses with 21 days apart. It is important to assess and educate patients that patients can have other vaccination 2 weeks before COVID-19 vaccine and 1 month after second dose of COVID-19 vaccine. Between doses of Pfizer, patients should not receive any immunization. It is just a reminder that as other medications for safety patient care, we need to verify 7 right, which are right patient, right drug, right dose, right time, right route, right reason, and right documentation. After giving the COVID-19 vaccination, we need to ask patients to wait for 15 minutes to ensure that patients do not have any reaction to the vaccine. Also, as part of required that we need to provide patient a CDC vaccination record card, side effect and adverse report fact sheet to take home. Aware of different types of allergic reaction occurs in different time frame are very critical to keep our patients safe and have immediately treatment to eliminate further damages. According to the U.S. Department of Veteran Affairs, there are 3 allergic reactions that we need to monitor. The first one is immediately allergic reaction, which will occur within 15 to 30 minutes. The symptom including feeling of impending doom, itching, flushing, angioedema, confusion, shortness of breath, tachycardia, bronchospasm. The second one called vasovagal reaction, which happens within 15 minutes, including feeling warm or cold, clamming skin, weakness, changes in vision and hearing, hypotension, nausea, vomiting. The third one is normally happen within 1 to 3 days after vaccination. The symptom presents such as pain, redness, swelling at the injection site, lymphadenopathy in same arm as vaccination, headache, joint pain, vomiting, diarrhea. Muscle or body aches, fatigue, tiredness, nausea, vomiting, diarrhea, rash, allergic reactions, swollen glands. If patients consistently have those symptoms, advise patients to contact their primary care physicians for further evaluation and treatment. It is so far until today, it is very rare allergic reactions nor long-term complications reported. We need to advise patients to contact 911 or go to nearest ED if any emergency signs and symptoms such as shortness of breath, severe headache, confusion, chest pain. On the handout given to patients, there is toll-free numbers or online contact if patients have any adverse event. With Veteran Affairs Medical Center, we use Veteran Affairs Drug Event Reporting System, also called VAADERS, to report any adverse events. If any vaccine administration errors, serious adverse reaction, motor system inflammatory symptom, case of hospitalization or death after COVID-19 vaccination. There are two main QSAN competencies related into this PFIZER vaccination training, which are safety and teamwork collaboration. In safety competency, the purpose of this training is to provide information relating to the need of the following CDC recommendation to handling and storage in the safe ways in order to maintain the mass effectiveness of PFIZER vaccine. In addition, knowing the contraindications, administer medication in timely manner, providing patient educations about what to do after and before having COVID vaccine that can keep patients safe and also promote patient outcome. In teamwork competency, nursing staff works closely with pharmacy to deliver COVID-19 vaccines in timely manner to optimize its effectiveness. Also, vaccinators use the VAADERS to report adverse events to keep patients safe and prevent further damages. These slides provide a short quiz to test on the knowledge that just learned. Knowing well this information can assist nursing staffs to give PFIZER vaccine in a safe way. These last two slides lists all the sources that were used in this training PowerPoint. That is all about my teaching presentation. Thank you for listening.